Nurses of the ER, what are some crazy behaviors patients do that are more common than we realize? This girl stumbled in at 3 a.m., completely pale and sweating bullets. No family, no friends, just her. Something about her was different though. She wouldn't speak normally, just whispered everything. The other nurses thought she was on drugs or having some kind of panic attack. "I'm Alicia," she whispered when I asked her name. She kept pointing at her stomach and making these weird faces. At first I figured it was food poisoning or something, but then she did the strangest thing I've ever seen in my 10 years working here. She grabbed the dry erase board from our nurse station and started drawing. Not words, but this detailed diagram of a human body. She pointed frantically at the lower right side, tapping it over and over. The drawing was actually pretty good for someone who looked half dead. Dr. Williams came over and ordered the usual tests: blood work, urine, basic imaging. Everything came back weird though. Her white blood cell count was slightly elevated, but nothing crazy. The ultrasound showed some inflammation, but nothing definitive. Classic appendicitis usually shows up clear as day on scans. Alicia kept shaking her head at everything we suggested. Pain meds? No. IV fluids? No. She kept pointing back at her drawing and making cutting motions with her hand, like she wanted surgery right then and there. Dr. Williams was hesitant. Young women her age sometimes have ovarian cysts that can feel similar. Plus, her symptoms weren't textbook appendicitis. She wasn't running a high fever. The pain wasn't in the exact right spot. He wanted to observe her for a few hours, but Alicia completely lost it. She started crying and pointing at the board again. She drew a clock showing different times and kept shaking her head. Then she drew what looked like an explosion next to her body diagram. I've never seen someone so scared and desperate. That's when she grabbed my arm and whispered something that made my blood run cold. "It's hiding behind my intestine. If you wait, it'll burst and kill me." How could she possibly know that? I convinced Dr. Williams to order a CT scan with contrast. Most appendixes sit in front of the intestine, but sometimes they hide behind it. It's called retrocecal appendicitis, and it's a nightmare to diagnose. The symptoms are all wrong and regular scans miss it. Sure enough, there it was. Her appendix was tucked behind her intestine, completely inflamed and about ready to rupture. If we'd sent her home with pain pills like Dr. Williams originally wanted, she would have been back in a few hours with a life-threatening infection. They rushed her into surgery at 5 a.m. The surgeon said it was one of the worst cases he'd seen. Another hour and it definitely would have burst. She would have needed multiple surgeries and weeks in the hospital. When Alicia woke up after surgery, I had to ask her how she knew. She smiled weakly and said her mom died from the same thing when she was 12. The doctors missed it because it was hiding in the same weird spot. She'd researched everything about appendicitis after that, especially the rare types. She'd been having pain for 2 days, but knew if she came in acting normal, they'd probably send her home. So she acted strange on purpose to make sure someone would take her seriously. The whispering, the drawing, all of it was calculated to get attention. 3 days later, she walked out completely fine.